Working on a Sunday, and here we are. This is my 62-year-old husband. There's a reason for me telling you his age, Gary, who started PRP in December of 2023. So he had his 4 sessions, a month apart. So that was December, January, February, March. And he continued on with his minoxidil nightly, the serum, plus washing it in corresponding shampoo. And here we are at the 8th month mark. So far, there's a really positive response. I'll show you the photographs in a minute that we took microscopically. The follicles are all responding. Some are throwing out grey hairs, and Gary is grey. And most of them are throwing out very dark brown or black hairs. So Gary had noticed over the years that the top of his hair was thinning quite significantly. He always had a widow's peak, so that's where you'd have a peak back this way and coming forward here with the hair. But the hair on top was thinning, and the back of his hair was significantly thin, that you could actually see his scalp. So we started the PRP on him as a model to see how well it would work. So what we noticed is the existing hair got stronger and thicker, and the follicles responded to the minoxidil and to the PRP. Now it takes 16 weeks to get from the bottom of the follicle as far as the skin, and that's the skin of the scalp, and then a further 16 weeks to be able to get from the skin of the scalp to be visible, and that's where we are today. And this is what we saw. So he's having his 6-month top up now, even though it's 8 months after we started, but it's usually 6 months after you cease. So he's having his biannual top up today. We've taken 10 mils of blood from him, at least Isaac has. It's spinning in the centrifuge, and we're going to re-inject him again. So he was asking me to know, do you really see a significant difference? He can feel a difference, and it's very reassuring when you're looking under the microscope to be able to see those new baby hairs coming out, and they're still babies, you see. So it's a very slow process, and I suppose that's the point that I want to make today. If you're looking for instant results, PRP is not the way for you to go, because it is a slow process, and sometimes people can lose their hair faster than I can keep up with the PRP. But thankfully, we have managed to arrest the thinning. His new hair is growing, very dark brown. When we were actually examining Gary's hair today, he had said that his scalp was sensitive. So for the first couple of times that you have PRP, the first time he found it about a 2 out of 10. Yeah, and then the second one, which was a month later, he found it more of a 4 out of 10. And I know for a fact that the third one and the fourth one was more of a 6 or a 7 out of 10. He did find it sensitive. And as the time has gone on with continuing use of minoxidil, you find your scalp sensitive?
All the time.
All the time. Is it tolerable?
Oh yeah.
Yeah. So only when you're using a brush or to comb your hair, or is it there all the time?
No, it's just when you're combing
your hair. Okay, so you can expect a sensitivity of the scalp. Now, here's another thing as well that I want to tell all of you who are currently having PRP, is that we are now encouraging people to wash their hair once a week with Nizoral shampoo. I'm going to put the link for it down here. It's an anti-dandruff shampoo. It's an antifungal, which can be bought over the counter at your pharmacy, and you're being encouraged to use it once every 5 days. So that would be a day that you would not use your minoxidil shampoo. You can use your minoxidil serum or conditioner for sure, but I want you to wash your hair in Nizoral shampoo. Because if there was any fungus in your scalp, now I know it sounds terrible, but oftentimes it's a cause of dandruff, and it's not awful, but it works very, very well. And it could actually, if there was a fungus in your scalp, and a lot of people, nearly 60% of the population have a fungus in their scalp, it will actually kill that and help them with the growth. So that's that. You're also taking oral biotin, which is part of the subscription service that you're in. What else are you doing?
Finasteride.
And Finasteride. So, sorry, I got cut out there. So Finasteride is taken orally, and spironolactone can be taken orally as well. Men and women can take oral spironolactone, but you'd have to go to your GP for that. And oral minoxidil, if you don't want to be putting the serum into your hair every night, you can get minoxidil to be taken orally, but it works as well topically as it does to actually get it to take it by tablet. But oral minoxidil is prescription only by your GP. And the Finasteride is only ever taken by men because it's a DHA blocker, or postmenopausal women. So if you're looking for more information in relation to that, just email me and we'll give you that information. I'm a nurse and midwife, I'm not a prescribing doctor, so you have to go to your GP for those. So overall, very happy with the progress given his age. So if this is the response from somebody who is 62, well then can you imagine what the response would be for somebody who is younger? My youngest client is 21, I think. So we're very hopeful for a very positive result for him, and the ages in between. And whilst Gary isn't quite looking like Bob Geldof, with all his hair, there is a significant improvement, and we can see it from behind as well. And I'm actually going to show you what he was like at the start of the journey to today, and that is 8 months. All right, any questions? Just get in touch to either info@browteak.ie, which is my main page, or the aesthetic clinic at gmail.com. And we'll get you the free information pack out. All right. Okay, the gun is back. For those of you who have been missing the gun is back. There we go. Okay, so Isaac is using the gun on his dad, and despite the sensitivity in his scalp, Gary is finding it a 2 out of 10?
Yep.
2?
Yeah.
Must be the new practitioner, do you think?